Patients often ask, is there something short of surgery that we can do to help rejuvenate the face or make the face more youthful? And sometimes, in addition to just being more youthful or younger in appearance, many patients come in and say, you know what, people think I'm tired or fatigued or crabby or I'm frowning a lot. So it's not always an attempt to make someone look younger. Sometimes it's an effort to help soften patients' faces, to help them look more pleasant or happier. And yeah, there are some things short of surgery that we will do, and actually do them very, very frequently. Sometimes they're done in conjunction with surgery, but often they're done before any surgical procedures are performed at all. Often it might be a stepping stone where patients not quite ready to have surgery done, but may consider that in a year or 2 or 5 years down the road. Certainly, Botox is a very well-known term, and many patients perhaps out there have already tried it. Juvederm is a filler, and I'll go over what that means in just a second as well. Botox, and this is where there's some confusion, is not something that fills up or plumps up the face. It is not like collagen or Juvederm or Restylane or other fillers. Botox is a substance that will help soften facial appearances by softening or weakening the contraction of the muscles in our face. So it doesn't fill in a crease or a line, but it softens the aggressiveness of how some of our facial muscles will contract. For instance, very common to inject Botox in the forehead because of patients frowning like that. And sometimes I can exaggerate, giving people even a crabby or a frustrated or tired appearance. We often think about it as paralyzing muscles, but that doesn't really do that. And certainly that's not the goal that we have in mind. What we're doing is we are weakening or softening muscles which can actually sculpt the face. We can actually inject Botox below the eyebrow, and because the muscles that are pulling the eyebrow down are weaker, the opposing muscles can even lift the eyebrow. So we can actually get a little bit of brow elevation or separation of the brows when we use Botox. So there are some things that actually change not just the lines or how we contract, but it actually can make the face look prettier by sculpting it with Botox. Now, on the other hand, a product like Juvederm, which we use here a lot, it's something called hyaluronic acid. This is something that will help to fill in parts of the face. When we age, we lose volume in our face. That's why topics such as facial filling, Juvederm, fat grafting are very, very common and really at the forefront of facial rejuvenation right now. So Juvederm is a product called hyaluronic acid, which is a normal molecule in the tissue that helps hold water and maintain a plumpness or fullness to the face. This is something that's taken off the shelf. It comes in a syringe, so it's something that's injected in a procedure room. When we age, we lose volume in our face, and that can show with thin lips. It can show with the creation of lines, like the lines from the nose down toward the corner of our mouth, with deeper lines in the forehead, with thinning even in the temple areas. We will lose that volume, and that tends to give people an aged appearance. So Juvederm is a product that will help to restore that fullness, that youthful plumpness, the roundness of a face. So we can inject a product like Juvederm into the lips, into the folds in our face, into our foreheads, even into the tear trough by our eyes, even into the temple area. We can sometimes even use this product to help give a better definition to a cheekbone or even along a jaw or the marionette lines down here. All things that tend to get exaggerated as we become older.
For more information on Botox or Juvederm, or to schedule a free consultation, contact the Center for Aesthetics and Plastic Surgery at 920-486-4421.